So, time for a Gobbet Opus, number 41, Frage and Diarrhea, from October 25th, 2008. I'm doing this on Thanksgiving Day, 2009, and I hope your entire Thanksgiving is Campylobacter free. I wish I knew half as much as I think I do. There are about 10,000 articles in PubMed each year related to infectious diseases. If I were to read one an hour, boy, would I be bored. It is not only new things to learn, but I'm constantly surprised by things I thought I knew, but didn't. These are rarely of clinical importance, but it really seems the more I know, the less I know. It's the old-fashioned definition of a specialist. She knows more and more about less and less until she knows everything about nothing. Take Bacteroides fragilis, please. It is the major anaerobic bacteria isolated infections related to gastrointestinal perforation, an important pathogen in the formation of abscesses. When killing anaerobes, you want to make sure you kill B. frage, as we call it in the biz. Because it is a common pathogen, I assumed it was a common anaerobe in the gastrointestinal tract. I was wrong. You know what I'm trying to say. Bacteroides fragilis makes up a small percentage of the fecal flora, and only 40 to 70% of humans are colonized with B. fragilis. Rather than being the predominant and a common part of the colon, as I thought, it is a minor colonic constituent and can be uncommon. The other thing I thought I knew about B. frage is that it did not cause disease unless it escaped the colon. That, based on new information, is also an error. B. frage is a newly described cause of gastroenteritis, aka the Hershey squirts, in humans. It turns out there's an enterotoxigenic Bacteroides fragilis, ETBF, that causes an inflammatory diarrhea. The organism is evidently endemic in Bangladesh, where the study was done. Enterotoxigenic means it secretes a toxin into the bowel to cause disease, a common mechanism for bowel pathogens to cause diarrhea, since it is the diarrhea that allows the organism to spread. Much of the world now, and all the world in the past, uses the same water source for drinking and waste disposal. I mean, where do you think Coors Light comes from? Quote, ETBF was identified to cause a clinical syndrome with marked abdominal pain and non-febrile inflammatory diarrhea in both children and adults. Fecal leukocytes, lactoferrin, and pro-inflammatory cytokines, as well as B. fragilis toxin systemic antitoxin responses, increased rapidly in ETBF-infected patients. Evidence of intestinal inflammation often persisted for at least 3 weeks, despite antibiotic therapy. End quote. I bet we have all seen a case or two of this. Patients who have diarrhea, quote, substantial abdominal pain and tenesmus, unquote, no fever, and negative studies as to the cause of the diarrhea. Occurring B. frage in the stool would be considered normal and not a pathogen. To confuse issues, up to 40% of controls will also carry ETBF, and there may be an association with bowel cancer with this organism, perhaps due to chronic inflammation. The depressing thing about these ETBFs is that 7% are resistant to metronidazole, aka Flagyl, for those of you who have sold their soul and speak a brand name only. And I thought that metronidazole resistance to Bacteroides was unheard of. Maybe I finally have a reason to order fecal leukocytes, usually a test that adds nothing to the diagnosis of diarrhea. But a negative workup with positive stool white cells could be a hint that the patient could have ETBF, although there is no diagnostic test yet for us lowly clinicians. But if I may make a recommendation, if you are going to Bangladesh for a vacation, and I love the Bangladesh Disneyland, don't consume any stool whilst you are there. The relevant article was Association of Enterotoxigenic Bacteroides fragilis Infection with Inflammatory Diarrhea, Clinical Infectious Diseases 2008-47, page 797. And just remember that if you eat tofurkey, that tofu causes dementia. Have a happy Thanksgiving. Bye.